just wanted to have a chat about boobs. I have had my breast implants for 13 years. I got them put in Thailand, Yan He Hospital, and I don't know what precisely is in there. So my boobs were like a C cup before, and with implants, I think they're 350 mils, 350 cc, sorry. They've been a double D/E depending on weight fluctuations, and they were pretty good for some time, I think. And then over the last 6 years, they have been doing this stabbing pain thing. It's not all the time, it is intermittent. Feels like it's coming very much from the base of them, like in close to my ribs, if that makes sense. I've had a couple of scans and they are intact, but owie. And also quite inconvenient for me in my life. When I'm well, I like to do all kinds of active stuff, including running. And just if you don't know, having like very large breasts or like double D/E cup breasts means very, very structural sports bra and a lot of strapping down. So that means that you're going along and you've got quite a heavy weight sort of bouncing up and down on your chest. Plus, you've got some serious cinch around your ribs to try to keep them still, which means that your breathing is more difficult. So for me, getting them out would be pretty ace. The reason why I'm bringing it up in the context of this channel is because, like I've mentioned, I've got a whole bunch of weird symptoms which could be related to, you know, many things, and I'm on a journey of finding out what it is that's causing them and how to make it better. But I think along the way, what I've decided is that anything that could be contributing towards my health not being fabulous has got to go, and it's got to be addressed and it's got to be fixed. So I was lucky enough to get an appointment with a breast surgeon last week on Friday, and she was great. Honestly, she was lovely. She was so reassuring. She was just kind of honest and, you know, sharing the information. Essentially what she's saying is breast implant illness or anything like it is not scientifically recognised in Australia at this point. So, but women who have been having weird non-specific symptoms for some time, including things like me, like fatigue, weird blood pressure, you know, recurrent illness, have had them out and some have felt better. So that's good enough for me, and delightfully she's put through the application for me to get them done, explanted, with the capsule removed. She's put through the application as being medically necessary, which means that my private health will cover it, and depending on my general condition, this means that I might be able to get them out within 6 weeks of me being declared medically fit for surgery, which would be phenomenal. We're not going to do a lift or anything. She doesn't do a lift. She's a general surgeon, not a plastic surgeon, so she's just going to take them out. I did ask about the lift because I was a bit concerned about being really unhappy once they were removed, and she was just like, give it a year. Your breast tissue will shrink back, your skin will shrink back, and if you really are very unhappy after a year, then it would be a good idea to go and get them lifted. But let's just play that by ear. I don't really want to put my body under any unnecessary stress by doing anything to it that's really above and beyond what is required. I don't want further recovery time. I don't want increased pain. I don't want extra scars if I can help it. So yeah, fingers crossed, right? I mean, I personally suspect my picture might be a little bit more complex than just breast implants and like an immune response to them. But like I said, it's a process of elimination, and at this point I will do absolutely anything to feel better and to feel like I can have, you know, the kind of lifestyle that I want, instead of just being recurrently ill and set on my ass and having to recover and cancel all life events, because that sucks. So yeah, I will, you know, keep you guys in the loop with that stuff. And yeah, there's a whole bunch of other things that are unfolding, so I'll update in a different video. All right, see ya.